Hello, I'm Dr. Sushant Srivastava. I'm Senior Director in Cardiac Surgery at BLK-Max Hospital in New Delhi. I do heart surgery. Cardiovascular disease is the #1 killer of people worldwide, and this is especially so in developing countries. To make a bad situation worse, these countries do not have facilities for an early accurate diagnosis or surgical treatment. A case in point is a patient we operated upon recently. His name is Abdul and he is from Gambia.
My name is Abdul from the Gambia in West Africa. I was complaining of shortness of breath, that is when I'm climbing on stairs or if I'm walking at a speed. Also I was having heart palpitation and then severe coughing that was really disturbing me. At certain point it was even giving me hard time to do my work. And then I had to complain this to the institution that I've been working to, and they decided to help me to send me abroad for a better medical treatment. So at the Ministry of Health, they have a collaboration with the hospital here, which is the BLK Hospital, and they assured me that most of their heart patients that have been taken to this particular hospital.
He's a young man in his early 30s, and he presented to us with shortness of breath. We investigated him and found that even at this early age, 3 valves in his heart had degenerated from rheumatic heart disease. These valves were functioning badly and needed to be changed.
A detailed evaluation was made and then I was referred to Sushant Srivastava for the surgery.
So we undertook surgery on him and we changed 3 valves in his heart, and by God's grace he is done very well.
And then luckily the surgery went very successful. It was a maximum take care for me. The nurses were very helpful, and then the doctor has been coming around all the time checking to make sure that everything is going as planned for them. So far it has been great, quite improving. I am working bit by bit and then I am improving. I'm trying to adapt to the new ways. It is a triple valve surgery, something that is quite rare at certain point, but then it has given me a new lease of life. I'm quite grateful to all the staff at the BLK Hospital. Without this surgery, it could have been fatal to my life.
Now, my message to all my friends in Africa is, if you have the slightest symptoms that you think could be from heart disease, go to your doctor, get yourself investigated, and if there is any uncertainty, please contact someone overseas who can make a full diagnosis and help you with your treatment.